For decades, international law enforcement treated cartels as agricultural smugglers operating out of rural fields. But in early 2025, the U.S. State Department fundamentally reclassified the threat, designating major Mexican cartels as foreign terrorist organizations. This designation grants federal agencies expanded legal authorities to target the financial and logistical networks of organizations that now function more like multinational, tech-driven conglomerates. The shift was accelerated in 2022 when the Taliban implemented a strict ban on opium cultivation in Afghanistan. By 2023, 95% of the country's poppy fields were wiped out, forcing criminal networks to liquidate their remaining heroin stockpiles and find a more reliable alternative. The result was synthetic acceleration. Cartels realized that by abandoning agricultural narcotics, they could eliminate their reliance on arable land, favorable weather, and seasonal harvests. Manufacturing shifted to industrial labs using chemical precursors. While these networks still rely on global shipping routes to source their ingredients, the transition has allowed production to scale with the consistency of a factory line. The drug trade has evolved from a localized border control issue into a complex geopolitical conflict involving international chemical regulations and global financial compliance. Modern traffickers operate with the agility of high-tech R&D departments. When China implemented a generic ban on metazine-class opioids in 2025, illicit chemists pivoted to unregulated alternatives within months. This chart shows the lethal potency of illicit opioids. Fentanyl is dangerous, but cyclophane is 10 times more potent. It is difficult to treat. Its massive molecules lock into opioid receptors so securely that standard doses of naloxone struggle to displace them. Traffickers are also lacing the supply with medetomidine, a synthetic animal tranquilizer. It is estimated to be up to 200 times more potent than xylazine, the sedative that previously dominated the illicit market. Medetomidine creates a diagnostic crisis for first responders. Because it is an alpha-2 agonist rather than an opioid, it is completely resistant to naloxone, often leaving patients in a deep, unresponsive coma even after their breathing is restored. By combining ultra-potent agonists with non-opioid sedatives, the illicit market created an environment where standard emergency resuscitation protocols are frequently insufficient. While the West focuses on chemistry, the revenue department of the global trade has moved to Southeast Asia's Golden Triangle. Here, synthetic drug trafficking has merged with industrial-scale cybercrime. Syndicates now use the exact same encrypted communications, logistics, and political protection networks used for methamphetamine to build highly fortified cyberscam centers. These centers operate through human trafficking, luring victims with fake job offers and forcing them to execute billions in cryptocurrency fraud. This chart shows the mirror swap system used by Chinese money laundering organizations. They collect bulk cash from U.S. drug sales and, through a digital black box, instantly provide clean Mexican pesos to cartels while moving equivalent cryptocurrency across borders. This convergence means that human trafficking and drug interdiction and cybersecurity cannot be separate. They are functions of the same criminal enterprise. To understand why demand for these ultra-lethal numbing agents remains so high, we must examine the human reality on the ground. Researchers at the University of Florida have identified a modern catalyst for addiction: artificial intelligence replacement dysfunction, or AIRD. This describes the profound psychological distress experienced by workers facing professional obsolescence. For many, the sudden loss of labor market structure and societal purpose creates a deep vacuum, one that is rapidly filled by chemical escapism. Addressing this despair is difficult. A major study on an experiment funded by OpenAI's Sam Altman found that providing unconditional basic income actually led to a drop in labor force participation and increased unemployment duration, potentially deepening the isolation that drives substance use. In response, cities like San Francisco are testing conditional models. Proposition F mandates that individuals receiving municipal cash assistance must engage in clinical treatment if they are found to have a substance use disorder. Technology is also being used to improve recovery. New AI diagnostic systems can now identify substance use disorders with 83% accuracy, allowing for earlier medical intervention and more precise psychiatric care. Ending the synthetic drug crisis requires more than just banning chemicals. It requires a strategy that combines blockchain forensics to dismantle laundering networks with precision medicine and policies that restore a sense of purpose to a changing workforce.